pair of cranial nerves are 12, as you can see in this picture. Cranial nerve 1 is also called the olfactory nerve. It is related to the sense of smell. अगर cranial nerve 1 में कोई प्रॉब्लम आ गई तो the sense of smell of an individual will be affected. Cranial nerve 2 is the optic nerve. It is related to the eyes. Any problem in cranial nerve 2 will lead to blindness. Cranial nerve 3 is the oculomotor nerve. अगर cranial nerve 3 में कोई प्रॉब्लम आ गई, the individual will suffer from ptosis, which means dropping eyelids, dilation of pupil and diplopia. Pupils की dilation हो जाएगी और diplopia यानी कि double vision हो जाएगा. Cranial nerve 4 is also called the trochlear nerve. In this, rotation of eyeball upward and outwards takes place. Rotation होती है eyeball की upward and outward direction में and diplopia होता है यानी कि double vision होता है. Cranial nerve 5 is also called the trigeminal nerve. It is the largest cranial nerve present among all the other 12 cranial nerves. Sensory function of cranial nerve 5 is pain and loss of sensation in face, forehead, temple and eye. It is also called trigeminal neuralgia. Motor function of the fifth cranial nerve includes deviation of jaw towards paralyzed side and difficulty in chewing. Cranial nerve 6 is also called the abducens nerve. It is basically a motor nerve, and if any problem occurs in cranial nerve 6, the patient will suffer from deviation of eye in the outward direction and diplopia. Cranial nerve 7 is basically the facial nerve. If any problem occurs in cranial nerve 7, the patient will go through paralysis in all muscles in one side of the face, inability to wrinkle the forehead, to close the eye, to whistle and smile. Inability to whistle or smile is also called Bell's palsy, and it is a condition of cranial nerve 7. Cranial nerve 8 is also known as the vestibulocochlear nerve. In this, if the patient suffers from cranial nerve 8 damage, he will suffer from deafness, tinnitus, nausea and vomiting. Cranial nerve 9 is also known as the glossopharyngeal nerve. In this nerve damage, taste disturbance, difficulty swallowing and loss of gag reflex takes place. Cranial nerve 10 is also known as the vagus nerve. In this type of nerve damage, hoarseness in voice, difficulty swallowing and talking takes place. Cranial nerve 11 is also called the spinal accessory nerve. In this type of nerve damage, drooping of shoulder takes place. Inability to rotate the head away from the affected side is also a symptom of cranial nerve 11 damage. Cranial nerve 12 is also called the hypoglossal nerve. In this type of nerve damage, paralysis of one side of tongue takes place and there is thick speech. Obviously, अगर आपकी tongue का एक side paralyzed हो जाएगा, your speech will be thick. You will be unable to speak properly. So this is a defect of cranial nerve 12. Now let's revise everything we have studied up till now. The 12 cranial nerves. Cranial nerve 1 is the olfactory nerve. Cranial nerve 2 is the optic nerve. Cranial nerve 3 is the oculomotor nerve. Cranial nerve 4 is the trochlear nerve. Cranial nerve 5 is called the trigeminal nerve. It is the largest cranial nerve. Cranial nerve 6 is the abducens nerve. It is a motor nerve. Cranial nerve 7 is the facial nerve. Cranial nerve 8 is the vestibulocochlear nerve. Cranial nerve 9 is the glossopharyngeal nerve. Cranial nerve 10 is the vagus nerve. Cranial nerve 11 is the spinal accessory nerve, and cranial nerve 12 is also called the hypoglossal nerve. So these were the 12 cranial nerves along with their functions. I hope you all liked this video about the functions of the cranial nerves. Subscribe my channel for more such videos. Thank you.